Hi, I'm Dr. Anthony Usera, Principled Chiropractor from Power of Chiropractic. And today we're talking a little bit about what is wrong with medicine. You know, I hate to say it, but I don't like to talk about what's wrong with things. I like to talk about what's right and what's good about them. So instead of first asking what's wrong with medicine, let's see what's good about medicine. Medicine is good in an emergency. Medicine is good in a traumatic situation. If somebody gets shot in the leg or has a car accident where they're bleeding and they have broken bones, don't come here first. Get checked out by a medical doctor, even if it's just the paramedics at the scene of the accident. I want to make sure that there's nothing more serious going on. Nothing more acute. If you're having a heart attack, don't go to the health food store. Go to ER. Go to a cardiologist. Go to somewhere where they can do something to save your life right now. It's not what's wrong with medicine. The real question that we should ask is, how are we using medicine wrong? See, in the United States, we're ranked about, I'm not sure if it's 37 or 39 now, in all the countries in the world. We're ranked 39. Even though we spend the most by far, we're one of the poorest ranking countries, not because of anything other than just people are using medicine in the wrong way. They're waiting until there's a crisis to finally take care of themselves. And this is something we talk a lot about here at Power of Chiropractic. You know, it's consistency over the long term that gets the best results. Let's say instead of talking about health, we're talking about your general level of fitness. And it is New Year's Eve, and you're feeling fat and out of shape from the holiday season of eating and spending and jolly making. And it's time to get back in shape. So a lot of people make a New Year's resolution saying, that's it, I'm going to get in shape. And then, well, somewhere around 6 weeks, which is Valentine's Day, they're already off the wagon and they stop going to the gym. And then sometime in late April, early May, oh, summer's coming, I better start getting back in shape. And so people start working out again. And then they're doing better. And then Halloween comes and they start going back down. And then the cycle just continues. Just a yo-yo. Getting a little bit better and then getting a little bit worse. But what would happen if instead of having some good and bad days or good and bad periods, if you could just stay on a consistent long-term schedule of working out? What would happen if instead of only practicing that foreign language right before you go out of town, what would happen if you consistently practice that foreign language on a long-term basis, just a little bit by little bit, day by day? What would happen if you wanted to go to school and you only study right before the test? And sure, you remember some things enough to pass the test, but do you remember enough things over the long term? When boards come at the end of your school year, or down the road when you needed to know something in your job? Wouldn't it be better instead to consistently practice and hone those skills and build day by day, working out every day, little by little, consistently over the long term, practicing that language, studying little by little instead of just cramming right before the test? Now I know, and I've been guilty of it myself, cramming works. You know, a crash diet where you lose 10 pounds over the weekend could work to get you into a smaller dress size, or to make you feel better when you go to the beach and take off your shirt. But it doesn't give you the long-term benefit. And over the long term, it actually could cause more damage and stress to your body. By the same token, chiropractic works with a consistent, long-term doing what's right, getting adjusted on a regular basis, instead of waiting to run out of gas, instead of waiting for a crisis situation. Get adjusted on a regular basis, maybe once a week, maybe 2 or 3 times a month. Only you know what works best for your schedule. But what matters most is at the end of the year, if you've been adjusted 30 to 40 times, you'll be way better off than the old version of you that it would only get adjusted periodically, only when you had pain. See, medicine works best when there's a crisis, and chiropractic works best over the long term. Medicine can help a crisis, and chiropractic can help an acute issue. But our strength is in the maintenance and keeping your body running the way that it's supposed to. Because wouldn't you prefer to have your body working at 100% consistently, instead of waiting for your function to get down to just 20% and you can barely walk, and then do something about it to maintain yourself? Wouldn't it be better to just keep yourself running the way that you're supposed to? That is the benefit of consistent long-term chiropractic. It's also the same benefit that you get when you take your vitamins on a consistent basis. If you only take them when you're sick, then yeah, that helps, but wouldn't it be better if you continue to take your vitamins on a regular basis? And then instead of waiting for a crisis, you're already strong before that illness tries to strike. So just to kind of cover everything again, it's not what's wrong with medicine, it's what's wrong with the way that we're using medicine. And wouldn't it be better to use medicine only as a crisis intervention and use lifestyle choices and healthy home practices for the general maintenance of your health? The power of chiropractic is here to support you in that. And chiropractic is one of the only healing modalities that can only be performed by somebody else. So for instance, I cannot adjust myself. And even though some people sometimes ask me if it's okay if they move their neck or if they twist themselves, you know, that's not the same as an adjustment. An adjustment is a specific force applied to the joint to help maintain motion and balance in order to allow full nerve flow. And sometimes if you just mobilize yourself, that's not giving you the best nerve flow, although it does feel good at the time. So like this video, comment and share, and I'll be looking forward to reading your comments and commenting back, and maybe I'll make a new video to answer some of those questions.